Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Neurofibromatosis. Introduction. Neurofibromatosis is a genetic disorder that affects the way cells grow in your nervous system. It causes tumors to grow on nerves. There is no cure for neurofibromatosis. Most people with neurofibromatosis only have mild symptoms, but in rare cases, the tumors may become cancerous. Severe symptoms of neurofibromatosis may require surgery. This program explains neurofibromatosis. It discusses symptoms, complications, and treatment of the disorder. Neurofibromatosis. Neurofibromatosis is a genetic disorder. This means the disorder is caused by changes in a person's genes. Genes tell the body to make certain substances. Neurofibromatosis changes the way cells grow in your nervous system. They may turn into tumors in your brain, spinal cord, or peripheral nerves. The brain is the control center of the body. It controls the 5 senses, as well as the ability to move, think, and speak. A network of nerves carries messages back and forth between the brain and the rest of the body. This includes the spinal cord. The spinal cord is protected by the vertebrae, or bones of the spine. Peripheral nerves are the nerves outside the brain and spinal cord. They bring signals from the eyes, ears, face, arms, legs, muscles, and the rest of the body to the brain. There are 3 types of neurofibromatosis. They include Type 1, or NF1. This type usually starts in childhood. Type 2, or NF2. This type usually starts during the teen years. Schwannomatosis. This type affects people in early adulthood. Symptoms. People with neurofibromatosis often have only mild symptoms. Neurofibromatosis may cause hearing loss, learning problems, problems with the heart and blood vessels. Severe neurofibromatosis may cause nerve compression. This can lead to deafness, strokes, chronic pain, or loss of vision. The symptoms of neurofibromatosis are different depending on which type you have. They can also vary from person to person. Symptoms of NF1 begin in childhood. They include spots on the skin that are light brown. They are called café au lait spots. Freckles may appear in the underarms and groin. Soft bumps on the skin or in tissue beneath the skin called neurofibromas. Lish nodules or small harmless bumps on the eyes. Café au lait spots are harmless and usually develop before birth or in very early childhood. Neurofibromas are benign or non-cancerous tumors. They can be located anywhere in the body, on the skin, just under it, or inside the body. If a neurofibroma affects more than one nerve, it is known as a plexiform neurofibroma. NF1 may also cause below average height and enlarged head, bone problems like scoliosis or bowed legs, learning disabilities such as ADHD. NF2 is rarer than NF1. Tumors may develop at the base of the brain on the nerves that go to the ears. These tumors are called acoustic neuromas or vestibular schwannomas. Acoustic neuromas are benign tumors, but they can affect the nerves they grow on. These nerves carry sound and balance signals to the brain. Symptoms of NF2 often begin in the late teen years or in early adulthood. They include balance problems, headache, loss of hearing over time, tinnitus or hearing a ringing sound in the ears. NF2 can sometimes cause tumors that lead to pain, numbness, or weakness, as well as facial droop, problems with vision or balance.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Neurofibromatosis is caused by changes in the genes. They may be passed down from parent to child, or they may develop on their own. Neurofibromatosis happens when certain genes that make proteins to regulate cell growth do not work properly. The gene does not make enough of the protein. This allows cells to grow in an uncontrolled way. Family history of the disorder is the main risk factor. About half of NF1 and NF2 cases are inherited. About 15% of schwannomatosis cases are inherited. Diagnosis. Neurofibromatosis is usually diagnosed in childhood or early adulthood. To diagnose the condition, your healthcare provider will perform a physical exam. He or she will ask questions about your family and medical history. Genetic tests can diagnose NF1, NF2, and schwannomatosis. Your DNA will be sent to a lab to be examined. Genetic tests include a blood sample, a cheek swab. Prenatal genetic tests such as amniocentesis can confirm neurofibromatosis in a developing baby. Imaging tests such as X-rays, CT scans, and MRIs may be used to identify problems with the bones or tumors. Complications. Complications of neurofibromatosis usually happen when tumor growth puts pressure on organs or nerves. Complications of NF1 include bone fractures or weak bones, cancer, epilepsy and stroke, high blood pressure, hydrocephalus or extra fluid on the brain. The tumors caused by neurofibromatosis are usually benign, but in some cases these tumors become malignant or cancerous. People with NF1 have a higher risk of leukemia, breast cancer, brain cancer, and soft tissue cancers. NF2 can cause skin lesions, hearing loss, and damage to the facial nerve. It can also lead to brain and spinal tumors that require surgery. Treatment. Neurofibromatosis treatment focuses on healthy growth, easing symptoms, and managing complications. There is no cure. If you have schwannomatosis, medications can help control your pain. Neurofibromatosis can cause large tumors, tumors that cause pain, or tumors that press on a nerve or on the brain. Surgery may help relieve symptoms caused by these types of tumors. If you have NF2, your healthcare provider may recommend surgery or stereotactic radiosurgery. If you have NF2 and hearing loss, hearing aids and implants may help. Cancers may be treated with surgery, chemotherapy, radiation therapy. If you have a child with NF1, monitor your child for new neurofibromas or changes in old neurofibromas, high blood pressure, normal physical and learning development, skeletal changes or problems, vision problems. Caring for a child with NF1 can be difficult. You may find it helpful to join a support group for parents.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Neurofibromatosis is a genetic disorder that affects the way cells grow in your nervous system. It causes tumors to grow on nerves. There is no cure for neurofibromatosis. Neurofibromatosis is caused by changes in the genes. They may be passed down from parent to child, or they may develop on their own. The symptoms of neurofibromatosis are different depending on which type you have. They can also vary from person to person. Most people with neurofibromatosis only have mild symptoms, but in rare cases the tumors may become cancerous. Severe symptoms of neurofibromatosis may require surgery. Complications of neurofibromatosis usually happen when tumor growth puts pressure on organs or nerves. Neurofibromatosis treatment focuses on treating symptomatic tumors with surgery or radiation therapy. It also focuses on managing possible complications. Thank you for using Explain.